What I try to do is we usually start with, just finding out the logistics, so making sure we have the right patient in the right place, first of all. And then just start a general conversation. I quite often just sit and just say, right, how can I help you? And listen for 5 or 10 minutes and try to get a feel for the whole story of what's been going on. And then look at targeted questions related specifically to the problem they've come to see us about. Then as the consultation develops, we often need to examine patients. So there'll be an abdominal examination, sometimes a rectal examination if it's related to the prostate. And then at the end, I'll try and explain where I think we are, what the potential diagnosis is, and how we would plan to investigate that. And then at the end of that, I would always ask if the patient has any questions and then address those. And then I always try at the end and try and bring the whole consultation together with some bullet points, perhaps 3 or 4 bullet points, just to make sure that I hope the patient leaves with an understanding of what I've tried to explain. Ideally, I mean, to be informed is knowledge. So the more information we can have about pre-existing conditions, and particularly with stone disease, any previous imaging they've had is absolutely invaluable. So if patients do have the chance to get a previous CT on a CD-ROM, that would be really valuable. And usually the GP letter is enough, but previous imaging is valuable. Yeah, just immediately afterwards, they would go down and see our PA downstairs normally and have the test that we've suggested organised. Ideally, we try to organise these as effectively and efficiently as possible within the patient's timetable. We sometimes have to dictate the timetable from a clinical point of view, but usually if that's not the case, then it's dictated by their timetable, and we see them as quickly as we can. We're very lucky we have on site ultrasound, cystoscopy, lithotripsy now, it's just been opened yesterday, CT and MRI. So we can offer all the investigations on site and then see them as quickly as we can afterwards.